Welcome to our next episode of our new podcast,
Our yet to be named podcast.
yet to be named. Although I think I have a name in mind. We'll look through all of the people that submitted their entries, and we'll see if anything good comes out. But
Mm-hmm.
we're close to naming it.
Mm.
So today our topic is going to be men's health, and
Mm.
our part of the practice that is specifically for men. With the Father's Day coming up pretty soon, we want to kind of start thinking about the guys and the dads, and they need attention too, and they have health needs and they have beauty needs, and we're here to help them as well. So, and here our guest today is Lexi, and she's our great PA who does wellness, beauty, and weight loss,
Mm-hmm.
and specializes in men and women, but specifically for our male part of the practice, she's in charge of the men's health and weight loss part um, of everything. So Lexi has a lot of experience with it, and we've trained in hormone therapy and ED treatments, of course, the weight loss part and general health. So she's a pro in all of those things, including beauty treatments, Botox, and lasers, and things like that too. So it's nice to have Lexi here today.
Thank you. I'm very happy to be here.
So let's talk about men's health and some of the issues, most common issues that come up when most of patients here in our practice are women, and probably like 90% of people who walk through the door are women, and so we kind of address their beauty concerns, their health concerns, their wellness, and weight issues sometimes. But the guys also come in, but they're a little bit more skittish. They're a little bit more scared about bringing things up. And, of course, our practice is mostly female run, except for me. But, we do welcome everybody and, try to make everybody very comfortable. But what kind of concerns would you say that guys come in with most commonly?
I would say probably by far the most common ones that I've been seeing are going to be fatigue. So, meaning like they're not waking up feeling well rested and they just don't have the motivation really to get through their day. They feel like they don't want to work out. And then along that note, they're feeling like they're not being able to hold on to their muscle mass. Maybe they're starting to gain a little bit of weight, even, which is abnormal, maybe because they're still trying, like their diet hasn't changed at all, and suddenly they're noticing, oh, why do my pants not fit as well as they did before? Some of the other ones I've been hearing most commonly are going to be like erectile dysfunction problems. Of course, it's directly tied to testosterone. Of course, there's a couple other reasons for it too, but that is one of the major ones. And so a lot of it can be low libido or erectile dysfunction. Is also, it seems to bring the men in. And I mean, these are problems that definitely need to be addressed, because yes, it's not going to kill you, but at the same time, like we should live our lives, you know what I mean? And I want men to feel comfortable to be able to come in here and discuss these things, because I feel like it's not discussed enough and that sometimes it is a little bit taboo or not talked about enough in a medical practice because they're embarrassed to bring it up, So I feel like creating this safe place, this place for guys, is really kind of nice and niche. Like it's something that I think doesn't exist,
Sure.
in other med spas. Um,
And we're not like like some of the places that are basically like a factory. You like come in and get your shot and
yeah,
see you later.
no.
It's not a mail order like, oh, just enter something. You talk to somebody online and you get your shot, do it yourself, whatever.
Hmm.
We really get into the depth of things and kind of figure out why.
We check for a lot of reasons.
Right.
Absolutely. I would say it's probably one of the best physicals you're going to get in your life. It's a pretty comprehensive, because we're running panels for pretty routine things, but other reasons for why you might be feeling fatigued, which there are numerous reasons, so we got to rule all those out first. And then if we see on your labs that, things look normal on that front, we can't find another good reason for it, but we do see that your testosterone is low end of normal. We say, hey, with these other constellation of symptoms, I bet you it's caused by your low testosterone,
Sure.
you know?
Yeah, just because you're not feeling your best and you think you need testosterone doesn't mean you need testosterone. I mean, yeah, sometimes
100%.
sometimes you do, but of course you have to make sure it's not something else, something
Completely agreed.
more uh, you know damaging to your health potentially. So
Yes,
yeah,
yes, yes, yes. And I feel like that's why I really love this place because we take the medicine side of it very seriously with lots of checks, we making sure that, because there are risks, of course, associated with testosterone replacement, but we monitor for them. So
Exactly.
really, it's it's a low risk because I'm keeping an eye out. You know what I
Yeah.
mean?
Yeah, it's not like, if you get testosterone from like your gym buddies and nobody watches anything and everybody just like
Yeah.
goes around just like all in a rage potentially,
Yeah.
and
Exactly.
wondering why. I mean,
Right, right, right.
we check for that. We make sure your levels are
Mm-hmm.
good, you're physiologic, you're comfortable, you're not over, you're not under, and
Exactly.
so there's a lot that goes into that.
Right.
Um, and and besides, of course, besides testosterone, weight loss is a very very big thing for men. Everybody tends to, metabolism slows down when you get older. Everybody tends to have that same concern. I used to eat what I want and never gain a pound, and now I'm just like I'm starving myself, and I'm
Ugh.
not losing weight.
And
And
that's just the worst.
yeah, so and it happens in men and women. Of course, women probably watching this like, oh, you guys have it easy. You just so
I always say that.
so much
Just
easier to
stop
lose
drinking
weight.
beer.
Right,
You know what
exactly.
I mean? But
But at the same time, no, it's not always
it's
so.
not. I
You know,
actually just had a patient today where
yeah,
we were talking about that. He's like, usually I can just cut out sweets. I lose the weight. It's not a problem. I did that and it didn't do it. I didn't lose the weight. So something else is happening here, I think. And it was true. We correlated it. Everything else on his labs was normal except for he had low testosterone, low normal, which is often for most men. You're in low normal.
hmm yeah, and then and that's the other thing to consider is we are more of a concierge type of practice, because low normal is not considered clinically an indication for testosterone. So, we basically provide a bioidentical version of testosterone in a pellet form, which is it's not covered by insurance because it's not really the indication of testosterone would be low testosterone below normal levels. But even though you're still considered in that normal range, but you're having symptoms, potentially you would benefit from getting testosterone, and a pellet is a great way to do it because much less side effects, less peaks and troughs. You have a nice steady state for 3 to 4 months, and you only have to come once every 3 to 4 months to get it done instead of once or twice a week shots.
Yeah. Absolutely.
Yeah.
I think that's the way to go. And to be honest, when I've been counseling my patients, we talk about both. We talk about, do you want shots or do we want to do pellets? And it's a conversation for everyone because everyone is different in their life. Some people do want to have that flexibility of, I don't need to come in. But then at the same time, maybe they want to control their dose a little bit better and again, not that we're changing doses all the time, especially with doing injections, but you can kind of change if you want to do it every 7 days versus every 10 days versus twice a week. And again, these are things that we can discuss whenever the time comes. But ultimately, in general, I do recommend pellets for all the reasons that you just said, because it's just so much easier for kind of everyone involved, to be quite honest. And that's why I enjoy doing it, to be quite honest, because I really see the difference.
Yeah, and it's really rewarding when you have patients coming in
Yeah.
and they basically tell you like everything the way you said it's going to happen is what's happening, right?
Hmm.
Because exactly the way they described it, and people have more energy, they can exercise more, they have
Yeah.
more sex. There's like
It
all,
really is like night and day,
yeah,
to be quite honest.
yeah,
And some guys who haven't ever had it replaced, they're like, I can't believe I've been feeling this way for so long. Like, I
right,
thought this was my normal. And then suddenly they're like, oh, I actually do have energy. I
yeah,
do want to have sex. I do want to go do these things.
right,
You know what I mean?
yeah,
That they just couldn't do.
exactly. Well, that's great.
Yeah.
So yeah, I'm so happy that Lexi's taking on this as part of the practice, and
Hmm.
work together, and we're looking forward to seeing more guys, and all the women can bring in their significant others,
Yeah.
and you know spread the word that we have this service, and it's very very much a concierge type of service.
Hmm.
Um,
Absolutely.
and with Father's Day coming up, you can think about you know giving somebody a gift certificate, or even do a consultation with Lexi. We do blood work and everything, and no obligation, just do the consultation, and if you want to proceed, we'll give you some options, and if you want to try something else, there's always those options too.
Yeah, absolutely. I
Yeah.
completely agree.
So one other thing I wanted to discuss with you is
Hmm.
so some of the ED treatments.
Okay.
Okay, so one very interesting one is it's called Magnum procedure.
Yes.
Okay, so there's a lot of ED treatments out there, and there's pills, there's pumps, there's all sorts of things. But one thing in particular, which is kind of like pretty amazing, it's kind of like I don't know why more people don't know about it. because it's such a simple thing, and it works great, and you don't have to take a pill, you don't have to do anything. It's basically, it is an injection, so it's a little scary for some guys, but
But we numb
um,
you first, don't worry.
yeah, exactly. It's the needle is thinner than a hair, and you numb, so you
Exactly.
don't really feel it. I mean, guys who
Hmm.
had it done, they say like, I didn't even feel the injection go
I
in.
would completely agree.
Yeah, but what it does is basically it improves blood flow, and that's all. Basically, an erection is blood
Yes,
flow, right? So if you can
exactly.
increase blood flow to the penis, you get an erection, and the more blood flow, the stronger it is.
Absolutely.
So what happens with guys is they get a little bit older, and potentially they can have some hardening of the vessels, you know, not in a good way.
Right. For
So
other reasons.
right, so the vessels they don't flow as well, so less blood is getting to the penis, so the
Hmm.
erections are not as strong. So
Yeah.
you can take medications, you can take Viagra and Cialis and things like that, which can help to dilate the blood vessels, chemically. You can do a penis pump, which can potentially dilate it, but it doesn't stay. Obviously, if you take the pump off, unless you do something, it's not going to stay there. Um, and then if you do this, if you do the Magnum procedure, it actually will relax the blood vessels, so more blood can flow, and then you get a better erection, you get better sex, and you get also a longer looking penis,
Yeah.
even when not erect. So um,
Correct.
it's a great treatment. Takes about 20 minutes,
It
and
takes longer to numb than it does
yeah,
to even do the procedure. The
exactly.
procedure is 2 minutes.
Yeah,
You
and
know.
then it lasts for about 6 months or so.
Hmm.
So it's a great kind of like hands-free way or pill-free way to kind of enjoy a stronger erection, and you don't have to come in multiple times. You don't have to do, some people do shockwave therapy. It's a good treatment, but it's usually 6 to 12 treatments, and you have to come in on a regular basis and to see some improvement.
Hmm.
Now with this, it's just one visit every 6 months, and that's it. You're off.
Yeah, I agree. It's probably one of the better ones out there.
Yeah.
Easy.
So that's good. So that's another kind of a thing that we offer, and
Hmm.
I think more guys should have this done. I think it's great. It's a great treatment.
Yeah, I think guys don't. Well, I was just gonna say I think guys don't like to complain, but they do. But maybe not about their health.
Right.
So
Yeah,
I
I mean,
think
it's
it's
embarrassing to kind of
it's
bring it up. Like, who are you going to talk to,
embarrassing,
right? You don't want to talk to your partner. You
right?
don't want to talk to, so you need somebody, you know, somebody confidential to discuss this with. So,
Exactly.
you know,
And this is something I talk about all day long, So even though I'm female and I know that can even be scary to talk to someone who's a female, this is something I'm very well versed in and I'm very comfortable speaking about and I don't feel embarrassed talking about. So I would hope that my patient feels exactly the same way because I really want you to be able to share everything with me so that way I can really provide you the treatment that I think is going to work the best for you,
hmm
you know?
right. Yeah. So, it's just like at the gym. We're a judgment-free zone. So
Yes,
we can,
absolutely.
we're not going to judge. We're just here
Nope,
to help you and make you better.
exactly.
Yeah.
Yes, 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 completely agree.
Okay. Perfect. So, what about Botox? What about Botox for guys?
Botox for guys. Okay, so I think more guys should do it, to be quite honest. I'm sure probably a lot of wives are like, honey, you've been in the sun too long. You know what I mean? And I think what's also important is you don't need to, there's different patterns of injection for males and females. So when a male comes in, obviously we're not giving them the same injection pattern. We're not trying to cause you to look more female or more feminine. Most men want to keep some of their lines because it is actually quite attractive to see that. So I would say for men, when we're doing Botox, we generally, it's kind of a fight between, yes, they have stronger muscles, but sometimes we give a little bit less because we want to maintain some of your natural movement. We're not trying to freeze you, unless that's your goal, of course, and then
Yeah,
we'll do
I mean, you've
it.
seen those movies, where they show the guys like this, or just like he
Yeah,
can't talk. That's
right.
the worst. Every guy's worst nightmare.
Yeah,
Like,
not the case.
I don't
No.
want anybody to know I had Botox. So
No, we're trying to keep it natural
exactly.
and kind of on that anti-aging type thing,
Right. Right.
because over time the muscles will start to atrophy and get a little bit smaller, so then maybe those frown lines that have been growing in for over the last 30, 40 years will become a little bit softer, and then in general the treatments can be spread out a little bit more after that or what have you. But
Sure. Yeah. I mean, keeping it natural is the key, especially for men.
yes.
And the goals for men and women are different in the way they want to look, and
Yes.
the shape of the face, the shape of the brows is different. So
Hmm.
definitely a different approach, but something that we're very versed in as well. Let's
Absolutely.
talk about weight loss. So, for men and women, there's different options out there. Of course, with the blockbuster drugs such as Wegovy and Ozempic, everybody is, all the celebrities are losing weight on it. Everybody wants to get those drugs, and it's hard to get them. They're pretty expensive. Insurance companies are kind of strict about who gets it.
Very, very, very. I work in primary care, as you know, and they are tight. You wouldn't believe it. Some insurance companies will not cover unless you're BMI 40, which to me is just absolutely ludicrous. You're getting someone who is going, most definitely will have developed diabetes, high blood pressure, high cholesterol, and now you're promoting this sickness, and then you have to go back, and it's, you know what I mean?
Yeah,
It's a tough
don't get me
circle.
started on this soapbox with
I can't, I know.
they
We
all
could
want
both
you to
get
get
on it.
sick so they can sell you drugs, right? I mean, like,
Ah,
yeah. So
I know.
the whole point is to prevent getting sick.
Yes.
You want to avoid gaining weight. You want to avoid being that BMI 30 and above. You want to avoid having those comorbidities, hypertension, diabetes, things like that. So just because they don't approve you because you don't meet those guidelines, but you're probably going to in a few years, and then they'll approve you. So that makes no sense to me.
I completely agree.
So
It frustrates me like no other.
right. So if you are kind of like trying to lose weight, and if you're on the way but you're struggling, um, you know, potentially we can help you with a generic version of the same medication. So the semaglutide, tirzepatide, those are available in a compounded version from a accredited, fully, vetted pharmacy that we get specifically for our patients, and it works the same way, except it's not a self-injection pen, which is the patented version of the medication. It's an actual injection that we provide to the patients, or in some cases where patients maybe live far away, they can't make it every week. We do sometimes give them the injections, but they still have to come in once a week for a checkup. I mean, once a month. Um, but we do a full panel, so we
Right.
do have to check everything, make sure
Yes.
that you don't have any serious underlying conditions that potentially need to be addressed first. We have to make sure you understand all of the risks. There are some possible side effects which you could expect, and we try to manage them and see if we can adjust your dosing accordingly. But yeah, I mean, everybody has to have a full physical before
Yes.
having that medication.
So, yeah, same kind of idea as when we're doing any type of hormone replacement. We are really making sure that there isn't another reason why you can't lose weight. For example, thyroid problems, it's probably one of the most common ones that people don't even realize are happening. So once we rule out a lot of these other reasons, then we can say, okay, yeah, and it's safe to do this. You don't have diabetes, or maybe you do, you have a little bit of it. We can still treat, because it is a diabetic medication, and overall it is going to help with insulin resistance, and it's going to help you lose weight. And I think what's actually exceptionally cool about what we do in this office and what's different from getting it from a pharmacy, is when you go to the pharmacy, you're getting a box of 4 pens. They're all the same dose, so they're all 2.5 milligrams. Here, you're coming every week. We can adjust the dose, again, like you said, based on side effects or how you're feeling. So let's say the first week you come in, we start you at 2.5, which is starting dose. Then the next week, if you're like, hey, it was good, I didn't really get that sick or anything like that, I feel like I could increase, then we'll bump you up a little bit. We'll go to 3 milligrams, you know what I mean? But everything's kind of a slow progress, and we keep you at the lowest dose possible for as long as possible, so that way you get the most benefit, and then we increase you once you plateau on your weight or something like this.
Yeah. Remind us, we had a patient recently who actually was a male patient, and he was kind of like same symptoms, as we discussed, gaining weight, feeling sluggish, can't exercise, cholesterol over normal, definitely high, um, and we started him on the weight loss and the hormone replacement. He kind of met all the criteria, so we got him on both. Got him the pellet, got him the put him on tirzepatide weekly, and then he lost what, like 20 pounds or 30 pounds. He lost within a couple of weeks.
I mean, that's crazy.
Yeah.
That's really good, though.
Yeah.
I mean, sometimes there is such a thing as losing weight too fast.
Yeah.
You know what I mean? Because you want it to be slow and steady, so that weight stays off.
But the thing is, he had a lot of energy. So
Yeah.
he was exercising a lot.
Okay, so that's different.
He was very active all of a sudden.
Exactly.
He was like completely changed his life. And did you see his numbers, his cholesterol?
No, I don't think I did, actually.
He went from like over 200 to like 70. It was crazy. It was ridiculous.
That's
I've never seen that
awesome.
before.
That's awesome.
Just from that.
But I mean, that being said, that's also the patient putting in work as well.
Right, of course.
Because,
But he has the
Yes.
drive, he has the
Yes.
energy, so like
Yes.
all of that kind of comes to play.
I completely agree.
So those kind of cases are like really make us happy. Like when we have a success, and you know, it's just, it's just, that's why we do this. We like having patients like that.
Exactly.
And yeah, part of it is, of course, patient has to be dedicated. They have to want to do this. It's not just the drug makes you lose weight. No, you still have to eat right, and you still have to avoid sweets and sodas, and try to move, and at least walk 30 minutes a day after dinner.
Right.
At the very minimum.
I agree. Because one of the other things I really counsel on my patients is because yes, the medication does make it feel like you don't want to eat, but you do still need to eat, and you still do need to eat protein, and you do really need to work out, because if you don't and you're not eating protein and you're just not eating because you're not feeling hungry, again, that's a problem. We would need to decrease your dose maybe a little bit. Instead of losing fat, you might be losing your muscle. And that's really not ideal.
Yeah, and so when you have people talking about, oh, how these drugs are terrible because they make you waste away and lose muscle, true, if you don't take care of yourself and if you're not being followed, yes, that can happen. But that's why we do the way we do
Yeah,
things. And
you're seen weekly,
exactly.
and Roseanne talks to you like so much about diet and exercise and what needs to be done. You get
Right.
weekly weigh-ins, so that way you're really checking in to see how is my fat mass changing versus my water mass versus everything else.
Right. It's
And
all science, whole science.
it's all we love science here.
Yeah.
And then in every month you see me, and then or someone else, another PA
Yeah.
or NP, and we track to see, okay, this is how you're doing from this month to this month.
Yep.
And we kind of go from there.
Perfect.
Yeah.
Yeah. So those are the things we do. There's a lot more, but we'll cover that in our next podcast. And thank you for tuning in. If you have any questions, please drop them below, and we'll kind of finalize our name pretty soon. I think we're close.
Okay, sounds good.
All right. Thanks, Lexi.
Yeah, thanks, Dr. G.
Bye.